Okay, welcome everyone. On behalf of Benefit Express, I'd like to thank you for joining us this afternoon for our new developments in health and welfare plans webinar. We're going to be moderated by Larry Grugine, ERISA attorney. Just to let you know, our next webinar is Tuesday, January 12th at 1 p.m. Central Standard Time, and that is Managing 2016 Reporting and Regulations. And then our final one in this series is going to be Tuesday, January 26th, and that is at 1 p.m. again. That is 2016 Changes in Healthcare Reform, so that'll be a big one too. These next two are, lots of good information in there. I'm going to keep everyone on mute, and then Larry will pause and we'll unmute. You can ask your questions at that time, or you can use the chat box, the questions tab in your GoToWebinar toolbar, and I'm happy to ask the question on your behalf and receive the answer. Any issues you have or any questions you need to communicate with me also can go through the toolbar through the chat box. And I think that's it. Without further ado, I'll turn it over to Larry.
Thank you. Thank you very much. What I'm trying to do today is go through some new developments, and this is not on healthcare reform, but on all aspects of the law dealing with health and welfare plans. So I took what I thought it was important from April till now to go through and exactly what some of the changes are. Some deal with healthcare reform, others do not. And so it's a potpourri of different things that I thought important for you to understand and to go through, and some of it will affect you, some of it will not. So again, I will review the changes from April to now. This review includes two new laws, final and proposed regulations from the EOC, IRS, DOL, and the HHS. And just be made aware there's probably going to be more changes towards the end of this year, the last 2 weeks. The IRS and all the government agencies, they like to release guidance before the end of the year so they can go on vacation. So expect some new things happening over the next few weeks. So the first thing deals with the IRS guidance in regard to van pooling. Now, I don't know how popular this is here, but in some areas it is very popular. And there's an 80-50 rule that applies to employer-operated, employee-operated van pools. And so the question comes up, well, how do you make that determination? And the determination is dealing with focuses on control. The relevant factors to consider when determining who operates the van pool includes who drives the van, who determines the route, determines the pickup and drop-on points and times, and the responsible administration. Remember, if it's employer-sponsored van pools and there's debit cards or vouchers available, then there cannot be any cash reimbursements. If it's private or other types of van pools, then it's a different story. So this guidance also notes that even when employees receive transit passes to pay for the van pools, it does not necessarily mean the van pool is private or public. The only time that those would apply if it is, again, employer-sponsored. So that's what it goes into. It goes into control. Over the past 6 or 7 years, we've been waiting for the DOL to release any type of guidance in regard to wellness programs. They've sued 5 or 6 different employers in regard to violations they thought were violations of ADA in regard to wellness programs, and people were asking, when are you going to come out with any type of guidance? In April of this year, they came out with new proposed regulations on wellness programs, and some of the aspects were rather interesting. In regard to the maximum incentives, what they indicated for ADA purposes, the 30% limit would apply to employee-only coverage. That's the maximum limit that would apply for all. And what's interesting about this, in the past, under the HIPAA regulations, that 30% requirement, one, only applied to health contingent wellness programs, not participatory. The EOC differs on that. And also what the EOC indicated was the fact that the 30% requirement would apply in all situations, and the 30% limit, similar to the HIPAA rules for non-tobacco incentives. But in regard to the HIPAA regulations, it indicates there's a 50% limitation if you're dealing with tobacco-related incentives. Now, what the EEOC said in that situation, the higher tobacco-related incentives permitted under the HIPAA regs only allowed unless the program does not include disability-related inquiries or medical examination. So if an employer, for example, tested for nicotine use, then the employer could not in that situation apply the 50% limit. They would apply the 30% limit. Now, here, right now, when these regulations were released, they limited the 30% to just employee-only coverage. Later in the year, and I'll be talking about these regulations, they came out with other regulations that expanded it if other dependents are participating under the wellness program. So generally, the 30% limit only applies to employee-only coverage. It increases to the family limit if other family members were allowed to participate. All their requirements, and they came out, and this was not surprising, they indicated that one, that the programs have to be voluntary, and you cannot put any adverse action against the employee who did not participate or fail to achieve health outcomes. Now, what they indicated was what you cannot do. What some employers were doing were saying, okay, if you don't participate in the wellness programs, we offer 3 health plans, but 2 of them will be off limits for you, and you can only participate in 1. What the EEOC said, you can't do that. You can't punish employees in that way. You can't deny coverage for those who don't participate under wellness programs. Also, under wellness programs, what they indicated, employees are required to receive notice explaining what medical information will be obtained, how it will be used, and restrictions on disclosure and how improper disclosures will be prevented. So if you have a wellness program, just understand that employees have to be notified of all these factors. Also, what the EOC is concerned about is confidential requirements. So medical information may only be provided to employers in aggregate terms and are unlikely to disclose the employee's identity, with certain exceptions for employers that self-administer wellness programs. The appendix to the regulations list legal requirements and best practices to protect confidentiality where wellness program is not part of a group health plan, where it's separate. Now, what many employers do in this situation, they hire a separate testing wellness program or provider to provide the program and to collect all the information, and the employer never sees that. They just see aggregate information. Also, the appendix also notes that when the wellness program is part of a group health plan, individually identified health information about the wellness program will be protected under the HIPAA privacy and security regs. So please understand that those rules also apply to any information collected under the wellness programs. Now, this requirement is similar to the HIPAA regulations. The wellness programs, including any disability-related inquiries or medical examinations, or part of such programs, must be reasonably designed. To meet this standard, the program must have a reasonable chance of improving health, not overly burdensome, to be subject use for violating ADA, and not be highly suspect in those chosen methods. Now, what does that mean in layman's language? Well, you can't have a program that's overly restrictive that most people can't participate. It can't be designed to give some people over other individuals a discount. So the more people that can qualify for a discount would probably meet this requirement. So if it's overly burdensome and most individuals cannot really meet the requirements, it's going to be suspect. And also, please don't forget that any wellness program has to meet any of the other non-discrimination rules, the Civil Rights Act of '64, Age Discrimination Act, and GINA. So all these, and that's why many employers are hesitant to sponsor wellness programs, because there's a lot of different requirements that have to be met. Also, the HHS came out with a ruling in regard to, this was not a ruling, but a series of questions, and they posted a frequently asked question guidance explaining how healthcare reform's self-only annual cost-sharing limits are embedded, where they indicated, this came out in early 2016, that even if you have family coverage other than self-coverage for individual participants, the self-only limit would apply in that situation. So you can't not have coverage unless the family limit is met. Also, too, under the Trade Preferences Act of 2015, this is going to be very pertinent in the next few weeks when you have to get ready to do the 1095Cs and 1094Cs, 1094Bs, excuse me. In the past, the penalty for these forms were $100 if you didn't file it. If you didn't provide it to the participants, another $100 if you didn't file it with the IRS. That penalty went up from $100 to $250. And so if as an employer you decided not to comply, not to file any requirements, it would be per return, there's going to be a $250 penalty for not giving it to the employee, another $250 return if you don't file it with the Internal Revenue Service. And the calendar year cap increased from $1.5 million to $3 million. So please understand that if you decide not to do the filing. So failures include the failure to file by the due date, failure to include all required information, or provide incorrect information. That's troublesome one because the predictions are that the experts are indicating that 60 to 70% of the returns filed will probably include incorrect information. If the failures result in intentional disregard of filing requirements, the per return penalty increases to $500 and the calendar year cap does not apply. The lower penalty limits continue to apply for smaller entities and for failures corrected within a certain period of time. So if you are late, the penalties won't be that severe. Also, what many people are asking, and all of a sudden now, the Cadillac tax is starting to get focused by many employers. And so just recently, the IRS released a second notice on Cadillac tax, how to implement these rules. And what they centered on, first of all, is, because many employers have them, what the effect of health savings accounts, health flexible spending accounts, and health reimbursement accounts are going to be affected in regard to determining how much the premiums are for the Cadillac tax. And the IRS is considering an approach under which contributions to these account-based programs will be allocated on a pro rata basis. Which means, for example, if an employer was going to give everybody $3,000 under a HRA, that $3,000 to be allocated over the calendar year. As this example in this slide indicates, for example, if an employer contributes a lump sum amount to a HRA in the beginning of the year, the contribution would be allocated ratably to each calendar month of the year. Now remember, in these situations, and this was scaring a lot of employers, all these different devices, HSAs, health FSAs, and HRAs are going to be added into the mix when determining whether an employer, their coverage is subject to the Cadillac tax. Health FSAs and employer flex credits, what these slides are trying to indicate, that anything pre-tax, both on the employer side and on the employer side, will be added to the mix and included in determining the total premium that an employer could be subject to in regard to Cadillac tax. So any contributions on a pre-tax basis, either employer contributions or employer contributions, or both, will be added into to determining the premium for the year. Now, what this indicates, the determination period for determining Cadillac taxes will be the calendar year. So it's going to be similar to what you're doing in regard to determining the 1095s and 1094s. So the IRS anticipates the determination period for all employers are going to be the calendar year. And the IRS acknowledges that potential timing issues will be different depending on the type of plan. Self-insured plans will not be able to determine the cost of coverage for the year until all claims are submitted, and health FSAs will have to wait until the end of the applicable run-out period. So it's going to cause some problems in that situation. And then insured plans will need to consider payments or premium discounts attributable to experience ratings, and these may not occur until the next coverage period. So in situations where employers have non-calendar year plans, it's going to be a challenge determining the absolute amount of the premium for these purposes. Reimbursement of excise or income taxes, well, in that situation, if you have an insured plan, and if your plan is subject to the Cadillac tax, what's going to happen is the insurance company is going to pay the excise tax, and then it will come back to you to get payment for it. So what the IRS is considering in this situation, where the amounts reimbursed for additional income tax may be excluded from the cost of coverage. So they're all considering this. So right now, the Internal Revenue Service has not actually come out with regulations. They're just proposing what they're thinking about doing. Also, there's some question under the Cadillac tax as which entities would be subject to the tax. So for coverage other than insured plans or HSAs, either self-insured plans or health FSAs, the coverage provider liable for the excise tax. So what that means, if you're insured, your insurance company will pay the tax. And then what they're considering they're considering two alternate approaches to determine who is liable. The first approach is this: the person or entity responsible for performing day-to-day functions of the plan administration, such as processing claims, responding to inquiries, or providing technology platform for benefits administration, would be liable. And under this, it would be the third-party administrator. But they're also considering a second approach: the person or entity that has the ultimate decision-making authority over the matters of plan administration, such as eligibility determinations, claims administration, and arrangements, would be liable. In most cases, this would be the employer. So this is not settled yet in this situation, who's going to be liable for these taxes. All right, let's stop right here. And Stacy, do we have any questions?
Okay, I do not have any on mine end, so let me unmute.
The conference has been unmuted.
Anybody has any questions? Anybody have any questions?
Well, I guess my question is, with all these complicated things in the wellness programs and so on, why do companies do it?
The reason why companies do it, because certain studies have shown that they do result in lower premiums, because the more that the employers are made aware of their conditions and catch it early, the better the result is going to be on the employers. What I think hesitated many employers in getting involved with wellness programs, because the EOC was hiding in the bushes, I said before, for 6 or 7 years. Now they're starting to come out with guidance in regard to this. So I think it's going to be easier over the next 1 or 2 years, once the EOC settles on this, to decide what to do. And as long as you work with, I think, a wellness vendor that can help you go through it, I think they can design a program that really meets all these different requirements. It's, and I think what really frustrates many employers is this. an employer says, well, I want to help my employees lose weight or quit smoking, and I want to give my employees an incentive to do it. And that simple idea, then it gets extremely complicated. All of a sudden, HR gets involved, and all of a sudden they tack on one or two other requirements in this, and as soon as that happens, then the program gets very complicated, and the legal requirements start coming in. And that's part of the problem. I think what an employer has to do is start very simple. Incentivize employees not to quit smoking, but go to smoking cessation programs. Just reward employees that go to the gym. So start really small first and get used to it, and then as time goes on, add more and more programs. I think if you do that, I think it's much simpler.
Thank you.
Any other questions? Anything else?
Okay, I will go ahead and mute.
Okay, the next thing
conference has been muted.
Transportation Veterans Healthcare Choice Improvement Act of 2015. In regard to the employer mandate, what they indicated that certain individuals, primary veterans, will be disregarded solely for purposes of determining whether an employer is an applicable large employer. So in doing this calculation for 2014, what they indicated, if you have any employees, an employee is not taken into account for the ALE determination for any month that he or she has medical coverage provided by any of the uniformed services, including TRICARE, certain Veterans Affairs, and health programs. And this is extremely important because when you're doing this calculation and you're close, you want to do everything possible to determine the number of your full-time employees to see if you're an ALE. And certain individuals are excluded. For example, if you are a corporation and you're an S corp, the S corp shareholders are also disregarded for this purpose because the only people that you're counting here is going to be common law employees. Another group of individuals that are not counted is any children or grandchildren of the shareholders are also not included. So this is another category of individuals that are not included. So any of your employees that are getting health care from TRICARE or any VA services will not be included for this purpose. Also for health savings accounts, after 2015, a veteran's receipt of VA hospital care or medical services for a service-oriented disability will not affect his or her ability to make HSA contributions. So this is beginning in 2016 because in the past, if somebody was getting services from the VA, they were not eligible to contribute to an HSA. They made an exception for these individuals, and now even though they're receiving services from the VA, they will not be considered to be, they will still be considered eligible for this purpose. Now, also, too, in regard to the 1094 and 1095, there are many questions in regard to HRAs. Whether if an employer sponsored a health plan with an HSA, whether that participation would have to be noted in the 1095B. And the final instructions replace the section on supplemental coverage with the section addressed to two common coverage situations under the heading coverage in more than one type of minimum essential coverage. So you have a situation where somebody sponsors a group health plan, and then they also sponsor a HRA. What this is saying is, employer sponsoring a self-insured a major medical program and an HRA is required to report coverage under either of the major medical or the HRA or both, but not both. So if you're sponsoring an HRA and you have to, and you basically have to file a 1095B, you don't have to include that. In the second situation, on the 1095B, a minimum essential coverage providers don't have to report for which the individual is eligible, only because the individual has other med coverage that is required to be reported. So also, if you are an employer sponsored with fully insured major medical and an HRA for employees enrolled in the major medical program, what they indicated in the instructions for the 1095B, you don't have to report the participation in the HRA if it's integrated with a group health plan. The same thing is said for the 1095C, but first of all, the reporting for COBRA. This is a very common situation for COBRA. In a situation, you have individuals that are participating under the group health plan, they terminate. And there were questions that came up of how to report that if somebody was an active participant during the year, then they terminated, and then to COBRA, how does that report it? Here, an offer of COBRA coverage made to a former employee upon termination of employment is not reported as an offer of coverage on line 14. And basically, what you would do is you would enter code 1H, no offer coverage on line 14, and 2A in line 16, indicating that person is no longer employed by you. Now, remember, under employer mandate, as soon as that person terminates, that individual is no longer, that employer is no longer under the employer mandate, but you have to do reporting on the 1095C. And this gives employers the opportunity to report something and do it correctly. But again, there's no, because it's not an offer of coverage, because that person is no longer employed. Also, for qualifying offers, the final instructions add an example involving full-time employees who receive a qualifying offer for less than 12 months. In some cases, ALEs, large employers, can provide alternative statements in lieu of the Form 1095C. The example illustrates that an LE member can use the qualifying offer code 1A on Form 1095C so long as the employer is receiving a qualified offer for all months in which the employee was a full-time and not in a limited non-assessment period. But the ALE member cannot furnish the alternative statement unless the employee received a qualifying offer for all 12 months. I don't think in this situation, I don't think any employer is going to provide that alternative statement, because you can satisfy this requirement by just giving the employee a 1095C, so why not do that? For counting in total employees, the final instructions, and this is for when you're doing the 1094C, the 1094C. What you can do here is there's a number of methods of determining the total number of employees, and this is on column C in part 3. What they did, you can do it the first day of the month, the last day of the month, the first day of the calendar, first day of the payroll period, the last day of the payroll period, and what they added is you get the final instructions state that the ALE can also count employees in the 12th day of the month. So when you're completing the 94C, this is another alternative you can use in the final instructions. Now, also what they indicated, let's go back for a second, also what they indicated in regard to reporting health reimbursement arrangements. There is some concern for health reimbursement arrangements that if you are sponsoring a group insured plan and a self-insured plan, and there's some confusion in the draft instructions, that what you had to do was also report the HRA. The instructions to the 1095C very clearly indicate that if you have an integrated health reimbursement arrangement along with a group health plan, either self-insured or insured, you don't have to separately report the HRA. Very clearly. Now, also to the final instruction to the 1095C, also what they indicated, that if you have a company with 3 different divisions, and each division has their own EIN numbers. When you're doing the reporting, each separate division that has a separate EIN must file their own 1095Cs and 1094Cs, and they must complete the whole 1094C, and then indicate if they're part of a control group that and this is in column, I think, D, that they're part of a control group, and then list all the other members of the control group in Part 4. Because remember, the employer mandate applies separately to each member of the control group. Each member will have to comply separately. So it makes sense in completing the 1095s and 1094s that if you have separate members of a control group, different divisions with different EINs, you have to make sure you completely fill out the 1094Cs and the 1095Cs. Now, we'll go into more detail next month, but these forms are extremely complicated, and you should understand the final instructions made it very clear how these forms have to be filed. Also, another law that was passed is the Protecting Affordable Coverage for Employees Act. This is an extremely important law. This legislation amends the small employer definition purposes for healthcare reform. Under healthcare reform, the definition of small employer was supposed to increase from 50 to 100. So under the insurance mandate provisions originally enacted by the healthcare reform, the small employer is one that employed not more than 100 employees in the preceding calendar year. And that was supposed to kick in 2016, which means all the different insurance mandates that apply to those employers from 50 to 100 will now apply in 2016. And that means that community rating, age rating, all that would come in 2016. So here, the legislation restores the pre-healthcare reform insurance market cutoff to 50 employees with the option for the states to extend the cutoff to 100, and some states have. But many states have decided to keep it at 50. In addition, the revised definition of small employer limits the employer's size for participation in the shop exchange to no more than 50 employees unless the state decides to increase it to 100. And many states I've talked to have decided to keep it at 50. Now, note that beginning in 2017, the states may extend the shop exchange to the large employer market, but it's open to every state to decide to do this. This was an extremely important deal. It prevented large increases for many employers. Also, finally, proposed regs were released, which would amend the current IRS regulations to provide for the federal tax purposes the terms inciting sex, such as husband and wife, that are interpreted to include both same-sex and opposite-sex spouses. The regulations would define spouse, husband, and wife to mean individually lawfully married to any other individual, and the term husband and wife would mean two individuals lawfully married to each other. So the regulations would also provide that marriage of two persons, two individuals, would be recognized for federal tax purposes if the marriage would be recognized in any state, possession, or territory. So in contrast, and this what confuses everybody, domestic partnerships, civil unions, or similar relationships that are not as marriage under the state laws are not recognized as marriage. Let's stop right here. Does anybody have any questions?
Okay, I do have two on my end.
Okay.
First is, when Larry gets to the qualifying offer section of the conversation, can he clarify qualifying offer? I think it's 11 on line 14 and 21 on line 16.
Sure, what a qualifying offer is. A qualifying offer is a situation where the employee doesn't pay more than 9.5% of the federal poverty line. Currently, the federal poverty line, the single poverty line, is currently $11,770, which means employees can't pay more than $93 or $94 a month for their coverage. Now, remember, under the regulations for the IRS, there's three affordability safe harbors. One is rate of pay, which is how much you pay somebody per hour times 130. The other is box 1 of Form W-2, and the third one is federal poverty line. The IRS has decided to use a qualifying offer as one of the choices. That's 1A. And if you provide a qualifying offer, then you can give them an alternative method of providing the 1095-C. And if you look at line 22, there's two boxes on line 22 of Form 1095-C, box A and B. One is a qualifying offer for all 12 months, and the other is a qualifying offer for less than 12 months. Most employers don't comply, but some do. If your employees pay very little for their employee-only coverage, then there's a possibility you can use that. What is advantageous for a qualifying offer is the fact that you, as an employer, don't have to complete line 15 of Form 1095-C. So that's why it's extremely important. Stacey, any other questions?
Yes. Next one, can an employer still offer a retirement-only HRA for retiree health care? And if so, what is the reporting?
In this situation, yes, they can. There are a number of exceptions to the law. Now, remember, generally an HRA has to be integrated. The difference is the exceptions to that is, one, if the HRA pays exempted benefits, which are dental and vision, then it can be freestanding. If it's retiree, it's also freestanding. And the third one is HRAs that are retiree plans. Retiree plans are not subject to health care reform. So please understand that. Now the next question is, do you have to report the HRA? Now if it's an HRA that's tied to a group medical program, no you don't, but if it's freestanding, that you do. Are there any other questions?
Okay, I just have one more. On the 1095-C, on the line 15, we don't have to put anything in because we answered 1A, but does 0.00 count as being blank?
You leave it blank.
Okay, great. That's all the questions on my end, so let me unmute and see if anyone else has any.
The conference has been unmuted.
Anyone else have any questions? Okay. All right, I'll go ahead and mute.
All right, the second
conference has been muted.
EOC regulations came out later this year, and it was in regard to spouses' status information. Employers offering wellness programs as part of their group health plans are allowed to provide limited financial and other incentives to an employee whose spouse is covered by the plan, receives health or genetic services offered to the employer, provides information about his or her current or past health status. Now, what they're saying here is that spouses can also participate under the wellness program if these conditions are met. So incentives would not be permitted for a spouse to provide his or her own, including the results of genetic testing, nor would incentives be permitted in exchange for current or past health status information about the employee's children, although an employer may continue to ask questions about the children's health status as part of providing health or genetic services. It can't be part of the wellness program. Now, what they said about incentive programs, they total incentive, including financial or in-kind for both employee and spouse to participate, that collects information about current or past health status, may not exceed 30% of the total cost of the plan, which includes the employer and any dependents who are enrolled. Now, this is important. In order to do this, all of the family must be enrolled in the wellness program. If you have a wellness program that is only the employee can be eligible, then it's only the maximum incentive is only based on the single premium. So the maximum total incentive that would be apportioned between the employee and the spouse, the employee incentives would be capped at 30% of the total cost of employee coverage, and the spouse could receive the excess up to the maximum total incentive. So it can be based on both, but again, they're individually determined, which is extremely important. Also, the participation has to be voluntary, just like for the employee. A spouse will be required to provide prior knowing and written and voluntary authorization for the employer to collect the spouse's health information, just as the employer must do, and the authorization forms must describe the confidentiality provisions and restrictions on disclosure of genetic information. Employers may not require employees or spouses to agree to sale, waiver of confidentiality, or their genetic information as a condition. All right, next is the agency's finalized assortment of regulations to implement the healthcare reform. And these were a series of regulations came out just a few months ago. First of all, for grandfather plans. The grandfather plan status is determined separately to each benefit package. They also adopt existing anti-abuse rules that curtail attempts, retain grandfather status through indirect plan changes, and add clarifying examples. And again, with the regulations due in more detail, describe what situations would cause the loss of grandfather status. Pre-existing conditions. While adopting previous guidance regarding to pre-existing conditions, the final regulations also clarify that these rules do not prohibit plans or insurers from excluding all benefits for a condition if they do so regardless of when the condition arose. Lifetime and annual limits. Under these, group health plans, including self-insured plans, are not required to cover essential health benefits, are necessarily barred from imposing any lifetime and annual limits on essential health benefits. Under these regulations, these plans may define essential health benefits by reference to any one of the 51 benchmark plans identified by the states and the District of Columbia, and finalizing some but not all existing guidance for HOAs and other account-based plans are permitted only if they're integrated with the group health plan, as we all know. Rescissions. Final regulations remind employers that rescissions cancellation is considered an adverse benefit determination subject to an external and internal appeals procedures. They also finalized previous guidance providing that prohibition on rescissions is not violated if the plan retroactively terminates coverage due to failure to pay required contributions, including COBRA, which is extremely important clarification. Dependent coverage. Dependent coverage with the final regulations clarify that adult children under 65 must be offered coverage even if they don't live in the particular service area, but this requirement does not affect the extent to which plans and insurers are required to cover out-of-network services for adult children. Claims and appeals. The regulations finalized without substantial change, extensive rules on claims and procedures. And again, what's very clear, they made it clear that under the final and fair review rules, a plan that relies on new or additional evidence in making a benefit determination must automatically provide the evidence or rationale to the claimant and give that claimant reasonable opportunity. The final regulations also extend the transitional period for using the NICA similar external rules through 2017. Plans and insurers in state without these rules and self-insured plans must follow the HHS procedure for establishing previous guidance and finalize these regulations. And in addition, temporary rules applying to external review process involve medical judgment are added to the list. In regard to patient protections, new clarifications allow health plans to require participants and beneficiaries to select in-network providers. They also clarify that when and how balanced billing is permitted for out-of-network emergency and other services. Also, in regard to a notice of adverse determination on both claims and appeals process, these notices would have to provide a discussion of the decision, if applicable, the reason for not following the views of the claimants treating professional, or the determination of another disability period such as Social Security. The notice would have to include internal rules, guidelines, and protocols used in denying the claim. So this is the clarification. Also, claimants would be allowed to present evidence and testimony during during the stages of the process. And prior to issuing a decision or appeal, the plan administrator would be required automatically to furnish the claim with any new evidence or rationale. And then also would they clarify if you're in a county that more than 10%, at least 10% of the population is literate in a language other than English, they would have to include a one-sentence statement in the applicable language explaining how to access language assistance programs. And the plan would be required to provide oral language services as a customer service. Rescissions would be treated as an adverse benefit determination, as I indicated before. And to ensure impartiality of persons involved in decision-making, decisions regarding hiring, compensation, termination, or promotion could not be based on the likelihood that such an individual would support benefit denials. And then in regard to, and this is important in regard to consequences of noncompliance, if for some reason the plan's procedures do not meet the requirements for claims procedures, what this is trying to say is the fact that then claimants, participants, and beneficiaries could sue before the claims procedures are over. That's what this is indicating. Lastly, this is a very interesting, in regard to filing Form 5500s, there was legislation that came out in July of 2015 that indicated that the automatic extension period for 5500s were going to be increased 1 month. This was passed in July of 2015, but the Fixing America's Service Transportation Act repealed this, and now, when filing 5500s, the old 2.5-month extension still applies. It wasn't expanded to 3.5 months. I don't know why they took this out, but they did. So this just passed a few days ago. Are there any other questions?
I do not have any on my end, so let me unmute.
The conference has been unmuted.
Does anybody have any further questions? Now in January, we're going to go in deep in the 1095Cs and 1094Cs. So if you have questions on that, we'll go very deeply into that. And remember, under those rules, if you find that you can't comply or you can't get the information fast enough, there are automatic extensions that you can get, both for not providing it to the employee and filing with the IRS. So the instructions to the 1095Cs have extensive provisions regarding how to file for these extensions. So if you have any questions in regard to that, let me know, and I can help you with that. Probably 1 in 3 questions I've been getting over the last month had just been filing on the 1095Cs. A very complicated area. Does anybody have any other questions?
No? I have a quick question. So, and I might have misunderstood something you said earlier. So my understanding is that as you're putting these forms together, that the government looks this year at as a good faith effort and is not penalizing.
That is correct, but they haven't defined what a good faith effort is yet.
Gotcha. Okay.
So you're correct on that, but again, they have the hammer over you. They could penalize you if they deem that what you did is not a good faith effort.
Okay.
It's been predicted that 60 to 70% of the forms will be incorrect. So it's going to be a mess. Any other questions? Thank you very much. We'll see you the 12th, and have a Merry Christmas, Happy New Year. Bye-bye.
Thank you, everyone. Have a great day.